What should you know about sport during pregnancy? Sports during pregnancy have many benefits, but it is important to take proper precautions and get medical approval. Especially if physical activity was not regular before. The practice of sport during pregnancy raises many doubts. On the one hand, there are those who believe that pregnancy is a stage of rest and tranquility. On the other hand, there are others who feel that sporting activity during this phase is the best thing to do. Experts agree that exercise during pregnancy is more than recommended. However, certain precautions must be taken because not all disciplines are suitable. In addition, it is not wise to practice an activity without discernment. In addition, sport during pregnancy has many benefits. Indeed, it improves mood, relieves back pain, prevents problems in the joints and accelerates bowel movement. What should be taken into account in order not to encounter difficulties? We will see it in this video. The intensity of sport during pregnancy. First of all, it is best to establish a program of physical activity under the supervision of a doctor. If you were exercising regularly before pregnancy, it will be enough to make a few adjustments. On the other hand, if you were more sedentary, the exercise should start slowly and gradually increase in intensity. Doctors recommend at least 2.5 hours of aerobic exercise per week for those who are new to sports. On the other hand, women who regularly practice sports should only slightly decrease the intensity. In general, all women can exercise during their pregnancy. The only cases where it is not advisable are in the case of vaginal bleeding or hemorrhage, if there are early contractions, when the expectant mother suffers from pregnancy-related hypertension, in the event of premature rupture of the membranes, commonly called rupture of the water bag. The first trimester. The first trimester of pregnancy is the most complicated for some women. If you feel extremely tired at this point, or have frequent dizziness and vomiting, take it easy with sports. Maybe that's not the priority right now. However, a regular walk can help. Therefore, the most appropriate at this stage, especially if you are not a big athlete, is to start with body-mind exercises, such as adapted yoga, self-loading exercises, or elastic bands and the Pilates. During the first 3 months, your body performs titanic tasks, so don't overdo it. The practice of a sport as such is advised only if you practiced it before. Unless it is a contact sport. Also, walking at a fast pace is a great option. It is also beneficial to go up the stairs as soon as you can. The second trimester. The second trimester is a more favorable stage for practicing sport during pregnancy. The most recommended activities are those that help you build more strength and stamina. But that doesn't have to include heavy lifting or contact exercises. Thus, the most advisable is to continue walking at a rapid pace. Likewise, swimming can be a great alternative. Indeed, she strengthens the cardiorespiratory system, helps in weight control, helps relieve back pain, tones the body. Also, during this stage, it is a good idea to do Kegel exercises regularly. Doing Pilates strengthens the pelvic floor. It is therefore also a possible and interesting option, as is the practice of yoga. Riding a 20-minute static or elliptical bike 3 times a week may be a good idea, provided your doctor agrees. The third trimester. Playing sports during pregnancy becomes a bit more complex at the end due to the weight of the belly. Effectively, this makes the movements more limited and reveals significant balance problems. It is not healthy to stay still, but you shouldn't overdo it either. At this stage, walking is still an essential activity because it is a great way to keep in shape. In addition, doing yoga and Pilates is also recommended, but you should add postural control sessions as well as breathing exercises. Conclusion. At all stages of pregnancy, it is important to maintain adequate nutrition and hydration while playing sports. Also wear appropriate clothing, including a bra. Also, if you are exercising sitting or on the floor, remember to get up slowly afterward. Finally, pregnant women should not participate in sports such as water skiing, mountaineering, scuba diving, or strenuous aerobic exercise. Racket sports, sports gymnastics or horseback riding should be practiced in moderation. And only if they were already present before the pregnancy.